Hello, friends. How you guys doing out there? Welcome to Hope for Jonathan. This is Jonathan Trailer, your host of Hope with Jonathan, and I have a very special guest tonight. This afternoon, he's my son, Jet Trailer, all the way in Abilene, Texas, and I wanted to interview him. Hey, Jet, say what's up to all the people out there.
Hello, how y'all doing today?
So, just to give you a little backstory on Jet. Jet's my son. He's 18. He just graduated last year from high school, and now he's attending Abilene Christian University. He was a four-year football player at Tybee High School in Kerrville, Texas, and he was also in the band. Played the trumpet. You were in
Marching band, yep.
marching band for 4 years, and he was just a great son to me and Melissa, and we really enjoyed attending the football games, and we really enjoyed watching him march in the band. And so I wanted to have him on as my special guest. He's he was around the whole time during my the years of battling kidney disease, and he seen me suffer with uh, you know all kind of aspects of it. And he also seen me go through kidney failure, and he's seen me go through dialysis, and now he's kind of seeing me go through transplant. But hey, Jet, I wanted to ask you some questions this afternoon, if and you just answer accordingly. But so let's roll back to July 8th of 2019. Um, do you remember like where you was at and what you were doing and like what happened with Dad?
Um, I'll break it down in a simplest form. So I think I had just gotten off work. I worked at HEB, which is a grocery store located here in South Texas. Um, I think I closed, so it was about 10. It was almost about 10:30 ish, maybe earlier. I can't remember the exact time. All I remember is Papal, which is uh, your mother's
Husband,
husband.
Robert Love.
Yeah,
Yeah.
yeah.
Uh huh.
Um, and he was picking me up, and so I was confused because I was like, usually you or is picking me up. Well, they picked me up. They took me to the hospital, and I'm like, what's going on? And they're basically explaining me that ambulance came to the apartment, took you to the hospital. You basically you passed out in a way. You couldn't get up, like you couldn't stand, you couldn't walk on your own. And from that moment, I was like, oh man, this is for real. We went to the hospital, and then we were brought to your room. And in that moment, I could see you. I could see it on you that something wasn't right because of the way you looked. You were very, white, like very white, pale. Your eyes and your mouth area were just like dry. I don't, it was a very like, it was like a scene out of a movie. It was like I walked on the set of like Grey's Anatomy or something. It was just like, it was like something you only see in those kind of movies.
And how did that affect you? How did that make you feel?
It it was a little unsettling at first, but I was glad that, we finally, convinced you to go to the hospital in a way, because it was almost like a pull and tug to get you to go. Because, I mean, if you go to the past, you thought you just had like, a flu or something. We didn't know. Like, we knew about your kidneys in the past, but we didn't know that it was this severe at that point. And then going and finally getting you to the hospital, I was like, man, this is where, things are gonna, for like a good turn, it's gonna come back and really help you. And it didn't affect me until it really didn't like affect me in a bad way until we got to San Antonio. That's when things got a little hectic in a way.
Yeah, San Antonio. So when I got there, it was pretty rough. I ended up in the ICU. I was in the ICU for about 3 days. They had me hooked up onto a pretty giant size dialysis machine, and
Hmm.
it was pretty serious. I have no recollect of it or memory of it because of I was blacked out. I was
Do you
intubated and
do you want me
on the
to
machine.
explain
You can go ahead and explain,
from
sure.
from my perspective? So, you were air flighted, and you were awake at this time.
Right.
Um, we got in a car, so you got there probably less than 20 minutes, about 15-minute ride in a helicopter. It took us about maybe 45 minutes. Mom was flying. We were trying to get to the hospital. By the time we got to the room, you had been on the machine, I think, about 30 minutes to an hour almost. You'd probably been on the dialysis machine. When we got there, the cardiac specialist, not the one guy that you were talking about, this was a woman. She was in scrubs. She was a cardiac, I think like an assistant or nurse or something. She was helping out. I don't know her exact title. She brought us to the side before we could go in, and in that situation I was like, oh man, please don't give us that news, because you know how that goes. They bring you
Right.
to the side.
Yeah.
And she said that when you got here, your heart had went into, what's the word, you know what it was.
Arrhythmia.
Yeah, where it didn't stop, but it went out of rhythm, so they had to
Right.
shock you. So
Right.
that was a little unsettling at first. I was like, man, this had nothing to do with your heart, but now it's dealing with that. And then they brought us into the room, and it was scary. Like, you were strapped to the bed, so it almost looked like you were in pain. You had tubes like in your mouth and your nose. Um, you looked horrible. Like, it didn't look. You didn't look like you. That was the thing. It was, and then the machine they rolled in that they had was about the size of one of those miniature vehicles that you see driving around the thing practically took up the whole room. But yeah, it was just.
So for you, those of you that are listening, I had type 2 diabetes and hypertension, and that's what caused my renal failure. And these are the effects of type 2 diabetes and hypertension that are not very well managed. I wasn't going to the doctor. I wasn't seeing any physicians for my illnesses, disease, and it led me to kidney disease. And I wasn't being checked out. I had some similar issues with urinary tract infections, things like that. And I had been told some years before that I was in probably stage 2 or stage 3. And then all of a sudden, a couple years later, I'm in stage 5, and I'm in in an emergency situation. So, for one of the reasons why I'm doing this video is to create awareness for kidney disease. If you're having any symptoms at all, please go get checked out. A simple blood test can tell you uh, where you're at and what's going on with you. If you feel like you have any symptoms at all, that blood test can save your life if you'll just go. And me, I was stubborn and literally almost died from it. So, but I wanted to ask Jet. So let's fast forward. Then I came home and ended up on dialysis in center.
Hmm.
And so, what did you think? What did you think about like dialysis in center for Dad? Like, did that did that have any effect on you at all, or what kind of effect
Um,
did it have on you?
Now, when you mean by in center, do you mean fistula or chest?
No, I'm talking about when I went to Davita.
That's what I mean. Do
And
you mean
yeah,
like which? Because like I have effects for
well,
both of them.
well, when I came home, I had the catheter, and my chest. So
Okay. So
yeah,
the one, yeah. So I have an effect for both of them. So the one with your chest, I mean, I couldn't hug you a certain way. I couldn't hug you like I normally could. That was kind of unsettling. I couldn't like, because you just got home, so I was like, and then for were you going Monday, Wednesday, Friday, or every day?
yeah. No, I was TTS. So it was
Okay,
Tuesday,
Tuesday,
Thursday,
Thursday, Saturday.
Saturday. Yeah.
So that was upsetting because I know like we couldn't really go and do things. We couldn't make trips to San Antonio. We couldn't, go like we really didn't go out much. We couldn't like go do things that we used to, like go see a movie or, go do this and that. And then plus with the pandemic, that kind of threw everything off. So we were really just stuck at home and, just
Yeah.
kind of doing those kind of things. But on the other side, it was really good because you were home. That was a good thing, and then also you were getting the correct treatment. So I mean, you were on the right path. That was a good thing.
So prior to dad going on dialysis, did you have any knowledge at all about what dialysis was and what it was for and what it was about? I mean, did you? Because I can tell you personally, I had no idea what dialysis was or what it entailed or anything. I woke up in the ICU basically on dialysis. So
Hmm. I
that's
I didn't really. I knew what it did. I knew it cleans your blood. I didn't know that everything that went into it. I didn't know like where they stuck you and all this. Like, I didn't know all the medical knowledge of it, but I knew it cleans your blood. I also didn't realize how important your kidneys are, to your body because, you get two. So I'm thinking, oh, I know it's a big deal, but like having you need to really take care of your kidneys because your kidneys affect everything. They affect your heart, your nervous system, just everything, even your immune system. Like you lose a kidney and now your immune system is just shot. Like it's crazy.
right. So when you go on dialysis and you have to have your blood filtered, it cleans out the impurities and toxins in your blood. And
Mhm.
also, if you they can pull fluid off of you through the
Mhm.
dialysis machine. And your dad was on limited fluid. I was on 32 ounces a day, which was kind of a chore at first. Then I got used to doing it, but even so, I would come in sometimes in center and be a little bit overloaded just because
Mhm.
of you had to also intake with your food, so you had to
Mhm.
calculate what you were eating with the the fluid levels, and
Mhm.
so and you seen dad like change his diet,
Oh yeah,
and you seen
drastically.
dad like
Yes.
dad. So Jet was my workout partner. Like Jet would go on walks with me. We would go to the gym together. Um, we would go on bike rides
Mhm.
together, and so you see me change like from a big man to what I look like
Mhm.
today. I'm around 222,
Mhm.
224, somewhere around there. At
Can I
one
give a
time I
little?
was 350.
Can I give a little background information?
Sure.
So, I'm studying. I'm majoring in kinesiology. People who don't know that, that's the study of sports medicine, and it's actually the study of the way the body moves. It's a more simpler term. So the way your joints, muscles, and just the way that your body moves according to a sport. And so I plan on coaching a sport in the future, football, maybe baseball, any sport really, but mostly football. So I've always been into working out, going to the gym. So it was just really fun to go with my dad and go work out. Plus, yeah, seeing you change. You were. I mean, I remember you as a little when I was a little kid. You were like 340. You were really up there, and then now you looking at you now, and you're 220. You're at your perfect height and your perfect weight. You're at that perfect weight size. So yeah, you just really changed for the better.
Yeah. So in the hospital, they took off like I think it was like 30 pounds of fluid. And
Mhm.
then as I went to the center, they progressed. And as I was following the renal diet, plus they were taking off even more fluid, I think they took
Mhm.
off a total of like 60 pounds off of me.
Yeah.
And then I lost weight by doing the renal diet. Anybody
Mhm.
out there that knows the renal diet, I was eating pretty much every morning. This was pretty much what I would eat was like eggs. Um, and I did eat the eggs with the yolk. I know some people say the yolk it causes phosphorus, but I ate eggs. I ate eggs so much that I just became sick of eggs.
Makes
But
sick. Yeah.
I ate a lot of eggs, some bacon, usually like high protein.
Mhm.
It's kind of strange because when you're on, like when they're talking to you about different stages of kidney disease, before you go into kidney failure, they want you to limit your protein because
Mhm.
you're spilling protein, from your kidneys. You got protein in your urine, is what's
Mhm.
happening, which is
Yeah.
not good, which leads to kidney failure. But then when you go on kidney dialysis, they want you to have protein to help, aid with your muscles and stuff like that, to build up, strength because your muscles start breaking down and deteriorating.
Mhm.
So, I was just trying to eat like high protein, things like that, and I had to really change my diet. So if you're out there, if you're interested, if you're fixing to maybe go on dialysis, and you need to know what you need to eat,
Mhm.
yeah, there's plenty of write ups on Google, and you should be seeing a dietitian.
Mhm.
Dietitian will lead you in the right direction as far as
Mhm.
what you need to eat and stuff like that. But
Can
so
I recommend some things?
go ahead.
Um, this is just me, and seeing it through you as well. Anyone who thinks they may have problems or want to prevent problems, I would recommend drinking water constantly. Pushing high non-sodium, no sugary drinks like soda. I would limit Gatorade, like all the sodium type drinks. If you want to get a Gatorade, I would drink like G2. The low calories are really good for you. Um, Water, obviously. Workout. I would try to exercise. I know it's hard for some people, especially with their schedule, but even like 30 minutes or even like 15 minutes a day, go for a walk or, you know, um, if you want to like go around the house and pick up things that think might be heavy and just walk around your house. The little smallest things can build up better and better and better. I remember you starting off, you were weak at one point. You would set your chair in front of you and you would step up on the you would do little step ups to build your leg muscles back up again. So I remember when you did that. So um even like going to the store and walk, like, even if you don't need to buy anything, go to the store and just walk around, you know,
Yeah.
just walk around. It's the best thing, keep your body moving and just stay healthy.
So those are great points, Jet. And I appreciate that so much. I want to say this. So, like, when I was in center, I seen so many patients that were just withering away. I mean, they had,
Mhm.
I think they just felt like they needed to give up. And man, I had got
Mhm.
in my mind, I said, I'm not going to be one of those people. I'm going to live. And I pushed myself to exercise and do things, and you're right. When I first came home, I was really weak. I had to use
Mhm.
a walker and basically learn how to walk
Mhm.
again. I didn't have
Mhm.
hardly any strength. And I started off exercising with my walker, and Jet's right. I was doing these like just small like stepping
Mhm.
exercises, things that they showed me from a rehab specialist that came in and see me. She showed me some steps that I could do and exercises I could do using the walker.
Mhm.
And when I progressed from that walker, which was only a couple of weeks, I started just
Mhm.
walking a mile a day, and then
Mhm.
and I progressed from there. So you take baby steps, and then you grow from there.
Mhm.
So you just the main thing is just to keep going and get your blood circulating. and
Oh yeah.
you don't want to get stiff, because
Mhm.
it's going to be harder and harder for you to
Mhm.
get going again if you just lay there and get stiff. So, but
Mhm.
for me right now, as a transplant patient, I'm trying to, kind of rebuild myself to where I was at before I went and had transplant, because I lost a
Mhm.
little while I was, when I had transplant surgery. And believe
Mhm.
it or not, just a couple of days in the hospital bed, it's amazing how much you lose as far as
Yeah.
muscle and stuff and strength and stuff,
Mhm.
and it's a major surgery. So look, we've talked about dialysis. Now, you remember when I went on home hemodialysis, where I was
Mhm.
doing it at home here with mom.
Mhm.
And so, like, what do you think that home hemo was more beneficial for me, or do you think in center was more beneficial for me?
I think both of them are. This is just for me. I think they both benefited you in some way. They were each, treatments in a form. I don't think this is just me personally. I think the home hemo was better for you. It benefited you more because one, you didn't have to wake up early. You could do it on your own time, your own schedule. Um, you could plan it out better. Um, I think if someone wants to do it, they should really look at the all the fine print, because like you're gonna need a person that's gonna need to stick you, and you're gonna need a person that can handle the machine. So um, I would just recommend, like, if you're planning to do that, and if you want to do it with your spouse, or if you want to do it with um, someone, really do the training, and really focus, and think about
Yeah.
if that's what you want to do, because it's a serious thing. You're basically performing a surgical procedure within your own home, so it's very it's very stressful.
Yeah, it can be stressful. That's why you got to go through the training. The
Mhm.
training's very important. You receive the training inside your center, and my center here in Kerrville, Texas, was great. My DaVita
Mhm.
center, they really went through. They were very thorough. They trained me and Melissa. My wife, Missy, basically from this could become go back to school and become a nurse from everything that
Mhm.
she learned.
Oh yeah.
And
Oh
she
yeah.
learned more than I did, because I was sitting in the
Mhm.
chair. But I mean, I was trying to
Mhm.
listen to as much as I can. But
Mhm.
let me ask you this, Jed. Let me roll back the clock a little bit. So you seen Dad at his worst. Like,
Mhm.
explain to people out there. Let's rewind a couple of weeks
Okay.
before I had kidney failure. You
So
remember?
you never went to the hospital?
Well, I never went to the hospital, but like the weeks before, like Dad was having some issues with
Um.
like driving. I was having talking out of my
Okay.
head, and my eyesight wasn't any good. I mean, explain to the people what Dad was like, prior
Um.
before kidney failure.
Yeah. So I would say about I started noticing things about 2 weeks prior. Um. One was your eyesight for sure. I remember you telling me to come with me. We're gonna go down and get a candy bar at the gas station. And one, I was like, you've never told me that. You've never said, hey, let's go to the gas station to get a candy bar. You've never said that. So that was one, talking out of your head. Um, but the drive there, it was about a not even a 2 minute drive, and it was probably the one of the most dangerous drives I've ever been on. It was on one of the main roads of Kerrville, and we were driving, and here's the sidewalk, and here's the car, and you were doing this, just bobbing, weaving, and then there was one point where we were on the sidewalk, and I kept telling you, "Hey, Dad, we're on the sidewalk," and you're saying, "Oh, no, I'm not, no, I'm not." And then we finally get home, and I told Mom, I said, "Hey, Mom, Dad was all over the road," and also, we started noticing a little bit of a mood change, and it wasn't
That's
like
fine. Hmm.
a bipolar type thing. You weren't just like mad and then happy. It was almost like you were a totally different person at one point. Like, you would be talking to us, and then all of a sudden your whole conversation would go off on something else, and it was just not you. We could tell there was something off. And then I mean, the the stubbornness, it was almost like, the stench. I mean, the personal hygiene, and it really wasn't you. It was just, it was what was happening. Your body was shutting down, and you couldn't really tell. And the personal hygiene, like the body odor, was just, it was bad. It was just to the point leading up to that point of you going to the hospital. It was getting bad.
Yeah. Hey, Jed, I appreciate your, perspective on it.
Oh yeah.
You know, these are the effects of kidney disease. For those
Mhm.
of you out there that's watching, these are the effects of kidney disease. If you have a family member or someone that's, maybe you notice some things, it could be, it could be kidney disease, and
Mhm.
or it could be underlining, disease, and they need to go get checked out. If you're noticing, anything the Jet's been, explaining and talking about, we're
Mhm.
talking about the effects of kidney disease, and it's a serious ordeal. Had I not listened to my wife, and she finally convinced me after, you know, trying to get me to go to the hospital, and I was 30 minutes from death. So had I not had, my wife and my son, my daughter telling me, you need to go to the hospital, you need to go to the hospital,
Mhm.
I wouldn't be sitting here right now doing this interview. And so Jet, so one more question
All right.
that I have for you, and I really
Mhm.
appreciate you coming on and helping your dad
Oh
fight
yeah,
kidney.
no problem.
Yeah, I really appreciate it, and you're helping fight kidney disease, believe it or not,
I
because
would
this.
I would
I'm
just
gonna
recommend
go
I would
ahead.
recommend anyone who is, having symptoms, or even if they don't think they have symptoms, but they know about family history of high blood pressure, or even type 2 diabetes, or high cholesterol, or anything, I would go get tested just to be sure, because you don't want it coming up and sneaking up on you and it's almost too late.
So that's great. That's a great point. So let me ask you, Jack, because you really haven't been around Dad because since transplant, because you went to college,
Mhm.
and so
Mhm.
what, like, explain to people like what happened before you had to leave for college. That basically, I went in and had the transplant, but like you had to leave and go to
Mhm.
college at the same time.
Mhm.
So you really haven't been there, but I mean, you did come up to the hospital, but I vaguely remember because I was on some high level pain meds at that time. But
Mhm.
um,
Mhm.
so explain to people like what you think about what's going on now with Dad with transplant.
Um I think it's a really good thing. I mean, it was a sad circumstance that, someone had to die to give you a kidney rather than it being a live donor. But I mean, everything's turned out for the better. I was a little upset that I couldn't really see you because of college. I had to go, and, I had to be here at a certain date, and it was right around the same time of you getting your transplant. But I've noticed, your whole energy, your whole persona is just, you know, it's all for the better. Now, when you did get your transplant, you were a little groggy at first, because that's normal with all the high level medicine they give you. But now, what is it? You're in what, week 4 of recovery?
No, I'm in my 6th week.
6 week. So, oh yeah,
Yep.
that makes sense, because yeah, yeah. Um, so yeah, like 6 weeks after, you're looking like a whole new person. You just everything's looking really good. Did you
Sorry about
move?
that, guys. I had to plug in my phone. My phone was fixing to die on me. Sorry about that. But hey, so I wanted to say I really appreciate you coming on, and
We're
it was
losing you. There
National
you are.
Sons Day. I wanted to let you know that I really appreciate you as a son, and I really appreciate who you are as a person and who you become. And I wish you all the luck at Abilene Christian. And I'm really looking forward to seeing you one day coaching
Mhm.
a a football team and all that
Mhm.
stuff. So I know how much you love football and how much
Oh
you
yeah.
you enjoy working in
Hmm.
football and all that. So
I'll be repping the Ravens tonight at 7:15.
Lamar Jackson, baby. Yeah,
Oh yeah. Oh
yeah.
yeah.
We like Lamar Jackson because we're originally from Louisville, Kentucky, even though we live in Texas. And he played at the University of Louisville. He was a
Hmm.
Heisman Trophy winner. We really enjoy him. I
Oh
don't know
yeah.
though, Jed. Patrick Mahomes, he's a good one too. Super
It'll
Bowl
be a
winner.
good. It'll be a good game.
Yes,
That's all I
sir.
know.
Yes, sir. Hey, so I really appreciate you coming on, Jet, and your points and everything. I mean, you got more knowledge than what I thought you did, to be honest with you. And I appreciate everybody watching. Looks like we got
Hmm.
Jamie on here, which is my sister. We got Brittany Doe. We got Jason. I think Melissa's on here. My wife. Uh, I want you to take this opportunity to, if you want to give any shout outs or anything to anybody. Also, I wanted to let people know about Jet. Jet's a gamer. I don't know if you want to throw you know, your gaming stuff out there. Phase Jet.
Okay. I I make video game videos every now and then, and sometimes I do like vlogging videos on my YouTube channel. You can find that at Jet Trailer or just Jet Jett. And you can follow me. You can actually find the link to my YouTube channel on my Instagram. It's Jet_trailer, TRAYLOR, and I'm right there. And then you can find the link in my bio.
You got any shout outs to anybody?
Um, Not really, no.
You don't have any shout outs? Anybody you want to say hello to or mom,
Hello, mom. I love you. Miss you.
your sister?
Oh yeah, Mackenzie. I love you and miss you too. I don't know if she's watching, but she'll see this later.
Yeah, and we miss you too, bud. We really do. It's awful. It's oddly quiet because I'm so used to hearing you gaming and all that, and your
Oh
room is
yeah.
just it's so quiet. But
Oh
of course,
yeah.
Mackenzie's here to keep us company, and she makes up for a little bit of added
Mhm.
noise. So,
Oh yeah.
but hey man, I really appreciate you coming on. I look forward to maybe doing this again. Let's do this with mom sometime.
Oh
I
yeah,
think
for sure. No
that would
problem.
be cool. And we may even, I don't know how many I can pull on here, but if I could get Mackenzie on here, then maybe we could make a family, a deal
I
of it,
think you
and we could
might be
have
able
it.
to do up to 4.
Yeah, yeah. But
Mhm.
hey, Jed, I love you, man, and good luck. And I appreciate everything coming on. And you take care. And we're gonna sign off for now.
All
Hey,
right.
if you guys are, and we'll talk to you later, Jet. But hey,
All right.
anybody out there that's facing a kidney disease, go get checked out. It's worth it. Don't be like me and end up 30 minutes from death. uh, you need to go get checked out. You need to stay in contact with and communicate with your doctor, and listen to your doctor, and they'll lead you in the right direction. If you are facing kidney disease, you'll need to see a nephrologist, and be prepared. They're going to want to run a lot of labs on you. But you know you what the greatest thing that I did once I realized what was happening to me was uh, the word acceptance. I had to mentally accept what was going on with me, and when I had finally came to out of the ICU, I had some moments in the hospital because I was in the hospital for 2 weeks. I had some dark moments where I had to, I had to really sit and dwell and think about some things. I had to really, you know, I had to accept what was going on mentally. And once I did that and realized, okay, I'm on dialysis now. I have to accept this. I have to do treatment, and I have to take care of myself going forward. And I started being positive after that. And after I was, became and had this positive mindset, my mind began to, you know, it was just easier for me to take on uh, the all the next steps, going in center, and then dealing with the catheter, and then having a fistula installed, and then having issues with the fistula, and then I ended up progressing and ended up where my fistula matured finally, and then I was able to go on home hemo, and then from home hemo ended up being transplanted, and I don't feel like I would be where I'm at right now if I hadn't remained positive. And I think acceptance and being positive is the best thing you can do if you're facing kidney disease and kidney failure. If you get negative and you don't want to listen to the doctors and you don't want to follow the renal diet and you don't want to control your fluid, you're looking at you're not looking at great things. You're not looking at a future. And for me, I wanted to live. I had a will to live. I had a will to survive. And that's what you have to have when you get, into kidney failure and and go on kidney dialysis. You have to have a will to live. And because anything can happen at any given time. I mean, you can have a bad treatment. I've seen patients in center that just about came, real close to death, and you know, it's just a real scary situation. Um, if if sometimes the technicians are busy with other patients, and I seen a patient, crash with their blood pressure, things like that, where their blood pressure would just plummet, and so it's anything can happen with dialysis. That was one of my main problems with dialysis was my blood pressure would drop, especially toward the end of treatment. It would just really go down, and I would have a lot of issues with my blood pressure dropping. Uh, but you know what? I was an overcomer, and I had the mindset that I was going to live, and I was going to continue to live no matter what. Hey guys, I want to take this opportunity to talk with you guys about kidneysolutions.org. They are a organization that helps people find a living donor. My great friend and advocate, one of the best advocates in the world, Kent Bressler. He is the leader of the kidneysolutions.org. He's a mentor. He's an advocate in the kidney community. He's a great guy. And right now, kidneysolution.org has many patients that are in need of a kidney. If you're, looking to donate a kidney, or if you're looking to be a donor, um, there are many people that are in great need on kidneysolution.org that are in search of a kidney. If you know anyone that is uh, possibly wanting to donate a kidney or become a donor, reach out to kidneysolutions.org and Kent Bressler. Like I said, he's been an amazing friend, mentor, advocate for me, and I'm a part of his support group. I do I share as much as I can for him and other advocates, and I'm going to continue to do so. As you guys see on social media, I share a lot for different people in need, kidney patients that are in need of a donor, and I'm going to continue to do so. It's a need that's out there that is great. The statistics for the needs of kidney and the diagnosis of kidney disease is mind blowing and staggering. There's not enough kidneys to go around for everyone that needs a kidney, and I was just blessed by the miracle of a direct donation that I was able to receive a kidney for the simple fact that the donor who had passed away had signed the back of his driver's license to become a donor. Let me encourage you guys out there, and it's just something to think about. There's a difference between becoming a living donor and then becoming a deceased donor, which basically means that when something happens to you, if God forbid, if you was to pass away, then they would take your organs and basically donate them to patients in need. So, to me, it makes sense uh, to go ahead and don't be a donor because let's think about this. When you pass away, if your body, you don't know what's going on with you anyway, right? So it just makes sense to go ahead and be a donor. God wants you to. I feel God wants us to recycle what He give us in the first place. And it's a personal choice for people, but I really feel like that. It's pleasing in His sight to be a donor and give people and share the gift of life with other patients that are out there that are struggling. uh, I mean, imagine people. My story is, and everyone of us have a personal story. My story is my story, but there's many people out there who had it way worse than me that have been on dialysis 4, 5, 10, even some of them 15, 20 years that are looking, possibly for a transplant. And I mean, imagine being on that list for that long, and every day, wondering whether or not you're going to get a kidney, whether or not you're going to get a heart, you're going to get lungs. This show's mainly focused on kidneys, but I mean, just think about that. Think about, other people out there that want to live a normal life or go back to living a normal life and can't because, you know, they're waiting on an organ. It's a sad situation, and I really feel like that we need more donors. We need more education on being a donor, and we need more people that are willing to be a donor. At least contemplate and think about it. Because there's a lot of patients out there that are in need. Hey guys, I really appreciate you tuning in. I love y'all. God bless y'all. And I'm going to sign off. Y'all take care. God bless.